Hi, today I'm going to talk about a term that you may have come across while looking for more information on your child's own diagnoses, and it used to be called mental retardation, pero ngayon ang tawag na dito ay intellectual disability. I'm just going to give you a quick definition and description, kaya tara usap tayo. Let's get talking. Hello! If you're new here, I'm Teacher Kaye and I'm a certified speech-language pathologist. Tulad ng nasabi ko, ang topic natin ngayon ay intellectual disability. Ito ang tawag natin sa mga individual na nakikitaan nating nahihirapan in two areas. Those are their intellectual functioning and their adaptive functioning. Sa intellectual functioning, ang tinitingnan natin is how well they learn new things, how well they absorb concepts, how they reason, how they problem solve, make decisions or judgments. Doon naman po sa adaptive functioning, ang tinitingnan natin dito is how they go about their day-to-day lives. Can they move independently? Nakakakain ba sila on their own? Nakakapag-dress, nakakapag-toilet, and things like that. Just some very fast statistics, ang intellectual disability or ID ay nakikita daw lamang sa 1% of the population, and 85% of that 1% are usually mild. Meron po kasi iba-ibang level ng intellectual disability. There's mild, moderate, severe, and profound. And all it means is how well they can get along with their daily functions or how much assistance they need so that they can get by. So, of course, people want to know what causes intellectual disability. So, again, we have our usual suspects, which are problems with pregnancy. Kunyari, merong environmental factors yung nanay, nagkasakit. Meron ba siyang na-ingest na mga toxic substances like alcohol or drugs. Maaari ding nagka-problema during labor. So, merong mga period na nawala ng oxygen yung bata. So, nagka-apoxia, no oxygen, or limited oxygen, hypoxia, and it could have damaged the brain. So, anything that causes damage to the brain, for example, traumatic brain injury din. Kunyari, nabagok or nahulog yung bata at a very early age, that could also be a cause of intellectual disability. But the reality of it is, 2/3 of people with intellectual disability unknown yung causes. Now, I can already imagine some questions that are going to come in like, yung mga diagnosis ng anak nila, itatanong nila if this is the same as intellectual disability, and the answer is no, magkakaiba po sila, but it is possible to co-occur with other conditions or disorders. So people with intellectual disability may also have autism spectrum disorder or ADHD or some other disorder. So some of the common disorders that co-occur with intellectual disability are autism spectrum disorder, epilepsy disorder, social communication disorder, and even anxiety and depression. Now, paano nadadiagnose ang intellectual disability or ID? Because it affects two areas, dalawang areas din yung i-assess. So, for the intellectual functioning, they use an IQ test or an intelligence quotient test. So, usually, ang average ng tao ay an IQ score of 100. So, kapag nasa around 50 to 70 yung IQ score ng isang individual, usually this says that there is a profound limitation in their mental ability. For the adaptive functioning part, they use standardized tests. These can assess how an individual can perform their daily tasks. And important is they also check adaptive behaviors. So knowing the limitation of the individual, titingnan rin nila paano nag-interact ang individual nito with other people to still be able to do the things that they want and need. In my episode about GDD or Global Developmental Delay, sinasabi ko na kapag may limitations yung bata in 2 or more areas, then they diagnose it with GDD. But beyond 5 years old, if the delay is still not resolved, then these limitations are already considered an intellectual disability. So bakit GDD yung unang sinasabi? It's not because the doctors made a mistake. It's because if the intellectual disability is very mild, mahirap po itong makita in the first 1 or 2 years and really only become more apparent when the children enter their school age or when they start trying to learn in an academic setting, for example. Pero ang unang-unang mga symptoms na nakikita of any intellectual disability is their limitation to communicate. So that is why it is so important to take note of the communication milestones of your child, from eye gaze to eye contact to gestures and finally talking. So if you notice na may mga skills na hindi pa present sa anak nyo in their specific periods of when they're expected, that's when we need to seek help from a professional. So the people who can diagnose with an intellectual disability are usually still our developmental pediatricians. You can find some online dev peds that I follow on my Instagram account. Usually yung pangalan nila ay may dev ped sa name nila. So feel free to look through the people that I follow on my Instagram. I really narrow it down to relevant accounts para nga mas makahanap kayo ng mga resources na kakailanganin nyo. So given that definition and those descriptions, what do I hope for you to take away from this video is that people with intellectual disability can still learn things, but at a slower pace. So what does this tell us? That we need to be more patient with them. So practically everything that I've been teaching you in this channel will still apply to someone with an intellectual disability. There are no different activities. There are no different techniques. It's just that we need to do it more explicitly, possibly with more cueing, a lot more patience for repetitions. It is also recommended that you all the more encourage independence and teaching them to do things on their own. Why? So if nakikita nyong nahihirapan sila to eat by themselves, instead of continuing to spoon feed them, you actually teach them how to pick up the spoon and try to do it themselves. Yes, makalat siya sa simula, but that is the way for them to move forward and keep learning for themselves and for their future. And actually, maraming may intellectual disability that can continue to lead a full life when given the support that they need. We should always look for social opportunities and other recreational activities like ipapasali mo sa isang sport or sa isang dance class or something to really see if there are other skills that they can be good at. Or even if they're not good at it, if they can enjoy it. Because again, our focus is always quality of life. And for entering into adulthood, you might want to look for vocational programs or vocational courses so that they can learn very specific tasks that could eventually be their livelihood or kung anong pagkakakitaan nila in the future. And that's it for today. If you like that or found that information useful, guys, please i-share niyo po. If you guys have any questions, feel free to message me on my Facebook and Instagram at Teacher Kaye Talks. And kung hindi pa po kayo nagsusubscribe, please click niyo na po yung red subscribe button and join our community. And hanggang sa muli, mabuhay!